Approximately 25% of all people suffer from occasional clinically relevant bad breath, and about 6% have a permanent bad breath problem. Most often the cause for bad breath can be found directly in the oral cavity. That is why patients who have this condition should seek the advice of a dentist, or even better, a specialist for bad breath. Dr. Grinfeld, you are a dentist specialized in the treatment of bad breath. Why is the topic of bad breath still a taboo?
Unfortunately, the topic of bad breath is still a taboo because it's a very embarrassing subject to talk about. You can't walk up to somebody and say, I think you have a problem, your breath doesn't smell too well. And in the same way, it's embarrassing for ourselves to ask somebody if we have bad breath. Even dentists feel very uncomfortable to bringing up the subject to their patients because they don't want to hurt anybody's feelings.
There's a general conception that you can smell your breath if you breathe into the palm of your hands. Is this true, or are there other ways to find out if you suffer from bad breath?
It's practically impossible to smell your own breath, and that's why this method that you described is not very reliable. Basically, there are three ways to find out if you have bad breath. The first one is the so-called airbag method, where you breathe into a plastic bag and try smelling the air. The second one would be to ask somebody, preferably somebody you trust, and hope for an honest answer. And the third one and most reliable method is to seek the advice of a specialist.
So, wie immer füllen Sie erstmal den Bogen aus und wenn Sie dann fertig sind, dann kommen Sie zu mir ins Zimmer. Ja? Ja.
Where does bad breath originate and what are its actual causes?
Let me answer the question not in terms of where it originates, but where it does not originate. In 99% of the cases, it cannot be stressed enough, bad breath does not come from the stomach. It has nothing to do with the stomach. In 90% of the cases, and that is in 9 out of 10 bad breath patients, bad breath comes directly from the oral cavity. And in the other 10%, and that's really less than 10%, it comes from ear, nose, and throat problems. As to the second part of the question, you have to know that our mouth is full of bacteria, and most of these bacteria are harmless. However, there are some bacteria that are very aggressive and they tend to hide in areas where there's no oxygen. When these bacteria multiply, they produce volatile sulfur compounds, which we detect as bad breath.
Dorsal heißt immer hinten und hier im ersten Drittel sind es nur 5%. Das heißt, die Zungenspitze da, die bringt überhaupt nichts. Das sind wirklich ganz, ganz hinten die Bakterien.
How can bad breath be managed effectively?
Basically the same way we manage all diseases. If we understand the mechanism of the condition, we can treat it effectively. Now, if we apply this principle to bad breath, it means that we have to find the spots in the mouth that are responsible for bad breath. And if we can do this, we can eliminate bad breath permanently. There is no generalized standard therapy, and the therapy we recommend is strictly based on the outcome of the diagnostical procedures.
What does the treatment consist of? And how many appointments are needed in order to get rid of bad breath?
There are usually 3 appointments. The first appointment lasts about an hour. There's a questionnaire to be filled out by the patient.
So, dann werden wir uns heute mal ganz kurz mal anschauen, was wir schon letztes Mal besprochen haben. Wir haben das auch wirklich richtig ausgefüllt, haben da nicht gelogen, haben nicht versucht, mich irgendwie anzulügen. Nee, haben wir nichts verheimlicht? Nein? Okay, gut.
Then I examine the oral cavity very thoroughly, especially those spots which we know to play a major role in the etiology of bad breath.
Okay.
We also do a breath analysis with a helimeter, a device called a helimeter. The oral examination, the answers from the questionnaire, and the breath analysis enable me to give the patient diagnosis. And it's this diagnosis that we use to set up the treatment plan. Usually there's a second appointment where we actually do the treatment, and the third appointment is very brief. We just check the results of the treatment.
It's important for patients to understand that they don't have to live with this condition. Today we know so much more about how and where bad breath occurs that we are able to help most patients very effectively and very fast.